last month, I've been working on reducing the price of testing to make testing more affordable for everyone and to get as many people who want to get tested. And the key to doing that is to bring the price down. So it started off by discussing with health facilities on their current pricing and how much discount they can give if I were to match it with a subsidy for my residents. But when they could not give me a discount, the standard prices were like 150 to 180 ringgit for this antigen test. So then I started taking one step back and looking at, okay, who are the people supplying the test kits and how does it work? What are the regulations behind it? What does the doctor need to do to be able to carry out the test? And in talking to many different distributors and in exploring this with other doctors, we managed to find the right distributors, negotiate a volume discount. So clinics who buy smaller quantity would definitely naturally pay a higher price. But we managed to negotiate a volume discount as well as simplify the process at the testing center. So a lot of testing happens at big hospitals where from the time you enter until the time the swab is taken from you, you would have gone through 5 to 10 different people. They have a lot of healthcare personnel, a lot of nurses involved in the process. And then after the swab is taken, it gets transported to a lab where it's processed. And this will naturally increase the cost. And what I can do to help bring down the cost is to see how we can simplify it while being compliant to MOH Ministry of Health's guidelines. And one of the best ways to comply with the guidelines, yet simplified, was to do it in a GP, the normal clinics, where the doctor takes the swab and does the test, processing the test. So it's a one-man operation. So that also brought down the price on the healthcare side, as well as we brought down the price on the test kit side. So combined together, we managed to put it together for 70 ringgit. Less than half the price outside. A lot of people will benefit. It's hard to quantify a number, but coincidentally, now that all the foreign workers have to do the testing, a lot of employers are incurring a lot of costs to do the testing. And by having more affordable testing, these Malaysian SMEs, these Malaysian small businesses would save on their costs. But individuals who want to do the testing, you have a worry that maybe you have contacted it because you heard that a restaurant that closed because one of the waiters has COVID, but you're not a close contact, so the Ministry of Health doesn't test you. But because you went to the restaurant 3 days ago, you might be worried that whether you got infected, and then you want to just do a test for your peace of mind, for your children, your family members. So there are a lot of Malaysians who just want to have that peace of mind. And having a peace of mind with 70 ringgit versus a peace of mind at 150 ringgit may make a big difference. So 70 ringgit makes it much more accessible for people to say, you know what, I can do it. I can just go up, get tested, and then know that I'm positive or negative, but at least I don't have that, it stays in your head, that nagging feeling, that worry. It's hard to shake off that worry. I don't set a target because I don't have a quota to fulfill. What I do want to do is to demonstrate that we can make testing cheaper and that those who want to get tested can afford to do so. So it is up to the people who want to get tested. I'm not here to say that, we must test 1 million people or 100,000 people. That's not in the game plan. The thing is just to make it accessible to those who need it. It's open to anyone because there's no subsidy element involved. We've managed to bring the price down without having to subsidize. So it's no limit. It's not only open to everyone, but there's no limit. If we get up to 50,000 people signing up to test, it's okay. So there's no issue with limiting it to any group of people. Anyone can get tested. So we have set up a hotline. Those who want to get tested, we encourage you to WhatsApp the hotline. We encourage you to register first. Then once you register, you'll get a confirmation of your time slot as well as the location of the clinic. Now, please bear with us. We are not releasing the name of the clinic because we don't want people to just swarm the clinic, because that's not in line with maintaining social distancing and ensuring that we don't spread the virus. So Clinic has a very limited waiting spaces. So we want to ensure that we set appointment time and you go at the right time. And thus we don't overcrowd the clinic. We don't have 20 people lining up outside the clinic, which is counterproductive towards our mission of breaking the infection chain. So just WhatsApp our hotline, and you'll get a reply and get your appointment slot. So it's that simple. Once you get your appointment slot, go to clinic during your appointment, tell them your name, and pay your 70 ringgit and get tested. That's it. Takes only a few minutes to get tested.
Yes.
So we say 15 to 30 minutes, but actually it's a bit faster. But yes, within minutes, you'll get your results. Everyone can get tested as long as you set the appointment and you come to the clinic, pay 70 ringgit, you can get tested.